that said, we're going to get started here. Again, we're talking about personal protective equipment, PPE, the N95 masks, the gowns, the shoe covers, the hair nets, the HVAC ventilation systems, air circulation systems, so on and so forth. And, like I said, the ADA did issue a recommendation that the D1999 code be billed for that. So we want to walk through the process here. So we took a poll in 5 different Facebook groups, and we asked, are you charging your patients for PPE? We got about 4,500 responses between the 5 groups, and the numbers break down to this. 46.76% as of this morning. 46.76% of offices said no. 25.9% said they haven't decided. 20.86% have said yes. So really, as of right now, we're looking at 21% about of offices that are planning on charging. 2.16% said they were going to increase their fees instead, and 4.32% have said they have not discussed it. Now, it's definitely something to be discussed among owners and managers, something for owners to think about, because as we come back, yes, this is going to be an added expense, but it doesn't have to be a killer expense if you are shopping around and finding the right materials and the right products and buying from the right vendors. But that's not what we're going to talk about today. Today, we're going to talk about the ADA statement regarding third-party payer reimbursements for costs associated with PPE. So we're going to break this down a little bit. This is the full statement that was released. I've broken it down into sections so that we can talk about each one real briefly. So first section, third-party benefit programs should either, number 1, adjust the maximum allowable fees for all procedures, or number 2, allow a standard fee per date of service per patient to accommodate the rising costs of PPE. Not doing so is deemed an automatic reduction in reimbursement rates. Okay, I'm not going to get into I agree, I don't agree. That's not what this is about. This is about going through with the facts that we have them as of right now. So, adjusting your maximum allowable fee, absolutely. I think every office should be doing that on at least an every other year basis, if not annually. You should be negotiating with the insurance companies, getting increased in your rates, your reimbursement rates. These are all things that should be happening all the time. And now, especially, it is important to do that. Okay, on every single webinar I have done for the past month and a half, I have told people, do not make knee-jerk reactions. But people are still making knee-jerk reactions. I'm going out of network. I sent my cancellation letter April 1st. I'm going completely fee for service. Don't make knee-jerk reactions, okay? Or I'm staying in network. Don't make any knee-jerk reactions. Don't change anything. But the ADA wants insurance companies to adjust their reimbursement rates. I agree, we all want them to adjust their reimbursement rates. Or they want the insurance companies to allow a per date of service fee per patient to accommodate the cost of the PPE. Prior to such adjustments taking effect, the ADA suggests that dental offices use the code D1999, which is an unspecified preventative procedure by report, to document and report the use and cost of additional PPE. Dentists can use this code once per patient visit per claim to attempt to cover the cost of PPE. So number 1, because everybody knows I am a stickler for wording. You see what it says right there. Dentists can use this code once per patient visit / claim. So once per visit. So you can't say we're going to bill it out twice because the hygienist had to wear PPE, and then the doctor came in for the exam and they had to wear PPE. It's a one-time per visit claim. No matter how many of your employees have to wear that PPE, it's one time per visit. You can't walk out 3 instances of D1999, which I have seen people suggesting. It is one time per visit. So, please, please, please keep that in mind. Okay, many insurance companies, when we talk about adjusting fees, right now, many insurance companies have actually suspended negotiations. They are not negotiating. A lot of them have closed those departments that handle that. It's just not happening. That part of their business is shut down, which means right now there's not a lot we can do to negotiate, but they are going to be reopening. And the key is being ready to go when they reopen. The other thing to look at is negotiations on fee schedules versus evaluating third-party administrators. There are times when it's much better to be in network with Aetna directly, and there are times when it's better to be in network with Aetna through Carrington or through another third-party administrator. So again, this is not what this webinar, what today is about. However, just so everybody has a heads up, next Wednesday, we are going to be doing another webinar with Dana Moss. And our entire webinar that day is going to solely be on insurance analysis and negotiations. So next Wednesday, we haven't set a time yet. It's going to be probably middle of the day. We are going to have a webinar, a full webinar just on negotiations and insurance analysis, looking at fee schedule reimbursements and third-party administrator agreements. That'll be next week. It'll be Dana Moss and I discussing it for 45 minutes or so. Make sure to join us, but you'll want to get in on that. So now we go to the next section here. Dentists should develop a standard office policy to document the additional PPE that will be used across all patients. You need to have a documented policy. If, and this is a big if the insurance companies do start paying on this, they are going to require that documentation. Okay. In addition, the next line, this documentation methodology will justify a standard fee across all patients. So what that means, and we're going to talk about this in a minute, you have to charge the D1999 code across all patients. You cannot just say we're only charging insured patients, or we're only charging patients with Delta, or we're only charging patients with United Concordia because the reimbursements are lower than everybody else. It is a standard fee across all patients, like it or not. Just because you've agreed to a fee schedule reimbursement that is 65% of your normal full fee, you cannot charge an insured patient for this fee if you are not also charging cash patients. It is overbilling and it is insurance fraud to do so. We're going to talk about it in a minute. Alternatively, dentists may wish to add a note in the patient's record to document the details of PPE necessary, uniquely necessary, for the visit when charging different fees based on the level of PPE used. So here's what that means. You have to be unified, that it is an all or nothing proposition. You can't just charge patients and not charge cash patients. However, you may charge differently if a patient is coming in just for a palliative treatment and an x-ray. You may not need the same level of PPE that you're going to need if you're doing a filling or a root canal or a prophy or anything that's aerosol creating. You just can't, you're going to use a different level of PPE. So you can have different levels of fees based on the services that you're providing. However, They need to be documented. And that document goes in the patient's record. It should be part of the chart note. We're going to talk about that. This next line, adjudicating such claims, the ADA believes it is inappropriate for a third-party benefit program to unfairly place the cost burden on dentists by disallowing or bundling charges for PPE on the pretext that the payment for additional PPE is included in the payment for any other procedure billed. Denied claims are typically billable to the patient. For Medicaid patients, please check with your state Medicaid agency. That's from the ADA. Somebody posted in a question, April asked, good morning, what about the patients that have Medicaid? Well, we're going to talk about that in a minute, but I can tell you no state or federal plan allows for the reimbursement of PPE, nor can it be charged to the patient. So any state or federal plan, that's not just all the Medicaids, but that's also anybody that's in network with Medicare. That's also anybody that accepts any of the TRICARE programs, active duty military, any federal programs. You cannot charge in addition for PPE. So it's going to be considered an inclusive fee, and you're not allowed to collect it from the patient or from the insurance company. You can bill it, but you're going to be told to write it off. Along these lines, somebody said as far as having a standard fee across all patients. If we charge for the 1999, can we do to everyone for treatment only patients, not hygiene? You can, but here's the question, Vanessa. Hygiene, if you are not using an ultrasonic scaler or a prophy cup, you're not generating any aerosols. So absolutely, you can do that, but it has to be, you can say we're going to charge hygiene patients, but not restorative patients. That's fine, but you need to have a standard office policy, and it has to be followed all the time. You can go either way. You can charge everybody, you can charge nobody, you can charge only restorative, you can charge only recall, only hygiene. You can charge different levels. You can charge $20 for a hygiene visit. You can charge $30 for a restorative visit. You just have to have a documented, written out policy. And that's the key. And if you're going to bill it, and again, we're going to talk about this in a few minutes, but if on the incredibly unlikely chance any of the insurance companies decide they are going to reimburse for this or they are going to allow it, they are going to require a copy of your office policy in addition to the list of PPE that was used for that patient. So you want to make sure you have that prepared and ready to go. So again, PPE charged to all patients regardless of insurance status. If you're going to say we're only going to charge hygiene patients, that's fine, but you have to charge all hygiene patients. You can't just charge insured hygiene patients. If you're going to charge every patient that walks in the door, that's fine, as long as there is a system to it and it is fair and even across the board. Okay, if you have a patient walks in that has Aetna and they're getting a DO 140 and a PA, you charge them the same fee, the same rate for the D1999 that you would charge a cash patient walking in getting the same exact services that day. So hopefully that makes sense. Anytime anybody has any questions, please feel free to use the chat or the Q&A section, and we will definitely get to them. But I cannot stress this enough. It has to be fair across the board. You have to be charging everyone the same way. You cannot charge insured patients differently than you are charging cash patients. So next, document the PPE used in the chart note. This is what we are telling people to do. Document what PPE was used for that patient in the chart note. That code requires a narrative as it is, it's a report, it's a by report code. So it's going to need a narrative. Many people don't know this, but there's a few of us insurance type dental people nerds that have been discussing this. Many insurance companies are going to start requiring, and some already have, not a separately written narrative, but a screenshot of the chart note as the narrative. So you have to start including, you're going to have to edit your chart note templates if you're digital, which I hope you are. Edit your chart note templates, because now you're going to have to start including what PPE is being used for each patient. So, please, please, please remember that. And in addition, like I said before, sending screenshots of chart notes as your narratives is becoming the new standard. It's the new way to do things. They don't want separately written narratives. The chart notes have to say the whys. So gone are the days of a chart note for a crown saying, crown number 7, 2 carpules of lidocaine, PFM, sent to lab, patient tolerated, procedure well, next visit, delivery. Those days are over. Your chart notes should say why you did what you did. Crown number 7, cracked tooth syndrome. Crown number 4, fracture on the mesial wall. Whatever it may be, you need to have your whys in there. Okay, for our remote billing clients, for years, we have been sending a screenshot of the chart note as the narrative. Your chart notes have to include that information. And now they have to include what PPE you are wearing for that patient. So I want to answer a couple questions here before we continue on. Mary, deltas, yet we're going to talk about this. That's shortly will be addressed here in the presentation. April said, what are your thoughts of a family fee? I have families of 7 or 8. Here's my thoughts. Does it make a difference? Are you wearing the same N95 mask going from one family member to the next? Are you wearing the same gown going from one family member to the next? So no. So if you are going to be charging per patient, then you charge per patient. It's the same thing. You're charging everybody equally. Okay, if you're charging a family of 7 $20 total, why am I coming in as a single person of just 1? Why am I being charged the same rate? It's a per patient fee. It is not a per family fee. So according to the ADA guideline, it's a per patient visit fee. So it should be charged as such. Amir asked, how often fees can be negotiated with insurances? Companies have told us every 2 years. Some have that policy. That is something that is totally between the insurance company and you, and should be defined in your contract or in the provider manual. There are some insurance companies that will only negotiate every 2 years. However, I think it's worth at least submitting your fee schedule to them annually, your UCR fees, your full fees. Submit that to them every month, every year. Every month would be a little excessive. Submit that to them every year so they understand that your prices have gone up. I don't think that's going to affect anything they do as far as negotiations. However, I do it just because I want to get the information in their hands, and I want them to be prepared when I am going to start negotiating. But again, this is something that Amir, next Wednesday, Dana Moss is the pro on this, and we're going to have her on for a 45-minute live webinar next Wednesday. So watch the Facebook group or watch the Practice Mechanic Facebook page for the links to that webinar. Next question we're going to talk about in a minute, talk about that in a minute, talk about that for a minute, and we'll talk about that at the end. So, all right, so next slide. Set your fees to a reasonable amount. Okay, I had 4 or 5 questions right in a row. What do we charge? What do we charge? What can we charge? Set your fee to a reasonable amount. Okay, what's going to happen is, believe me, in a few months, the federal government is going to need money. They're giving away trillions of dollars right now. They're going to need money. They are going to be looking for any possible way to increase their revenue, and profiteering off of a pandemic is both a civil and a criminal offense. So don't overcharge, but don't undercharge. Okay, know what your costs are. Any good business person knows what their costs are. Know what it's going to cost you for a mask. Know what it's going to cost you for a gown. Know what it's going to cost you for shoe covers and for the aerosols and for everything else that you're doing. Know those costs and base this off of those costs. So if everything together is costing me $6, honestly, I would probably charge 10, just because it's not just the costs of everything, but there's also a certain cost to having an employee ordering those extra things now. There's a cost to having them being stocked. There's delivery fees. Your delivery rates are going to be more because N95 masks weigh more than a normal level 2 mask. There's going to be little increases here and there. So know your costs, but do not look at it as a profit center. I can tell you, I've seen dentists who are saying we're charging $50, we're charging $75 per visit. In my opinion, that is absolutely ridiculous. And it goes back to people making knee-jerk reactions at a time when we should be just calm and watching what happens. So there is no standard fee. It's going to be up to each office. However, do not overcharge. Do not look at this as a profit center, because it is not going to be. And believe me, over the next 12 months, every single thing every business does is going to be scrutinized. If you got that payroll protection program loan or the economic injury disaster loan, you gave them the right to audit your books. You gave them the right to look at your orders, to review invoices, to make sure you are ordering from American manufacturing first when it's available, even if more expensive. That economic injury disaster loan, that $10,000 grant, or $1,000 per employee grant, came with a lot of sideways requirements that people don't realize. Okay, when you have an SBA loan, they have the right to audit your books at any time for any reason. And they're going to, because they're going to be looking to recoup as much of that money as is humanly possible. So, please make sure you're setting reasonable fees, because this is going to be a different time for most of us. As far as charging or billing for PPE applying to orthodontics, if you're doing an aerosol generating procedure, which isn't every day, but it does happen, there is no difference between an orthodontist, a general dentist, an endodontist. The appropriate PPE for each service is the appropriate PPE for that service. That's why we go back to having a system, having a process in place in writing for what you're going to charge, how you're going to charge. You're going to charge certain patients by procedure for PPE. So, restorative care, orthodontics, if we're removing braces, it's going to be one fee. If we're attaching new braces, it's going to be another fee. If we're just changing a wire, it's going to be a different fee. These programs, your policies need to be written out for this. So it is super, super important that you have those documented. So last question I'm going to answer right this second, because the rest we're going to cover momentarily. Can the D1999 charge be inclusive in our in-house savings program? So essentially included in their base price, not charging them extra. Absolutely it can, because most in-house savings plans that I create, one of the terms in there is, your preventative care is going to be covered. Well, the D1999 code falls under the preventative codes. Therefore, it's inclusive. However, make sure you're still charging it out and writing it off so that it shows as being charged out for every single patient. All right. Next question. And then we're going to move on here. How do you send a screenshot of chart notes? Depends on what clearinghouse you're using, depends on what attachment software you're using. Most of them, NEA, Remote Light, there's a screen capture button when you are in that individual claim. You open up a copy of the chart note, you hit the screen capture button, and you draw a little rectangle around the chart note. So Alicia, feel free to email me or Facebook message me, and I can kind of walk you through the process depending on which software you have. And we'll get through to that. By the way, anybody that does have any questions, please feel free to either Facebook message me or you can email me. My email address is rick@practicemechanic.com, rick@practicemechanic, MECHANIC.com. Email me. I will respond to your email without question. So next thing we're going to talk about, and there's a couple people that have already asked about this in the Q&A and in the chat. The reply. This is the reply that was received from Delta Dental. So we're going to get a little in-depth in these over the next slide, but their response is this. The American Dental Association released a statement on April 21st, 2020, regarding the anticipated increase in PPE costs for dental providers due to the pandemic. As a result, we have received numerous calls asking for Delta Dental of Michigan, Ohio, and Indiana's approach to the issue. Here are the keys we would like to clarify as a result. So let's start there. Number one, this says Delta Dental of Michigan, Ohio, and Indiana. However, the vast majority of Delta companies are going to follow these guidelines. This is their recommendation, and I know there is talk between the states that have already said they will reimburse $10 per appointment and the states who are relying on this. And we'll see which way they go, but I do expect in the next month we're going to have a unanimous consensus from all Delta companies in the country, as well as many of the other insurance companies who are all leaning in the same way of this Delta response. So let's take a look. The three keys that Delta would like to clarify as a result of the ADA's recommendation. Is Delta paying for code D1999 for PPE? Not at this time. They don't believe that PPE for an employee is a billable code. It's not a procedure that prevents dental pathologic processes. And Delta's current policy is that PPE is not billable to the patient. That is something you agreed to when you signed your contract with Delta. It's in there. A lot of people are saying, I'm going to review my contract. I'm going to review my contract. Believe me, I reviewed hundreds of them. It is in there. You are not allowed under your current contract with Delta, and I will say with the vast majority of insurance companies out there, to bill for PPE sterilization fees, et cetera, et cetera. It's excluded from billing. You can't do it. It's in the contract that says you can't do it. So why did the ADA mention using code D1999 as an option? They don't know. They didn't discuss it with anyone prior to their communication, and the ADA did not return our emails asking for clarification or correction. I don't agree. I don't know about that. I know that the ADA is very good about replying to emails, especially with something like this. However, that's their official statement. This next line is the important one. The ADA cannot modify our agreements with providers. They are absolutely 100% correct. The ADA is not a governing entity. It cannot alter a law. It cannot modify an existing contract. So the agreement that you have with Delta says you cannot charge additional for PPE no matter what. The ADA suggesting that D1999 be used as an option for billing PPE, it's their codes. You know, the ADA owns the CDT codes. They can do whatever they like with those. What they cannot do is they cannot modify your contract with Delta that you agreed to, agreeing not to charge additional for PPE. That is the unfortunate where we are of all of this. And then the last line is Delta of Michigan, Ohio, and Indiana considering assistance to dentists to cover the cost of PPE. They're exploring options. If you look at many of the Delta websites, they are offering loans with interest. They're offering advances against production for the same time period of last year, with interest. There are opportunities out there for assistance, but I can tell you, Delta is not paying for or allowing you to charge the patient for the D1999 code for additional PPE. Okay, if you are in network with Delta, you cannot do it. So many of the insurance companies are following in these guidelines. Many of the insurance companies are going to be consistent with Delta's statement that PPE is included. I would suggest reading your contracts. You will find that it is in 97% of them specifically stated you can't charge for it. I'm not saying I agree with it. There's something we're going to have to do. Something's going to have to change because the costs are increasing even more and reimbursements are staying level or are even going down. California Delta is dropping their fee schedule, their reimbursement rates again this year. Something has to be done. Unfortunately, right now, until there is a rule requiring the insurance companies to reimburse for this, the contract stands, and there's not a lot you can do. Now, with that said, I would bill it out on every single patient. Unfortunately, it's your cash patients that are going to carry the burden of payment. Your insured patients, you're going to be writing it off the vast majority of the time. However, I would still bill it out every single time. If you end up writing it off, Vanessa, you asked this question, looks like insurances will end up having you write it off. That's absolutely correct. If you're an in-network provider, the vast majority of insurance companies are going to require that you write this off, and you will not be allowed to collect it from the patient. And I'm going to warn you now, if you think that Delta doesn't know what's going on and isn't going to send out letters telling their subscribers, if your dentist is charging you for this, please let us know. It is against the contract violation, et cetera, et cetera. They're way ahead of us. Believe me, they're on top of it. That's just the unfortunate truth. I mean, if they're able to send a letter to a patient when you go out of network telling telling your patients that you are now an out-of-network provider, and here's a list of 25 of the closest in-network providers where they can save money, believe me, they're going to hammer on this one too. So, a lot of people said that would never happen. It happened. This is going to happen as well. So, please, 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 please pay attention. Bill it out every time. But if the EOB comes back and it says this is an inclusive service, this is against the contract, you're not allowed to bill it, you write it off. You cannot bill the patient. Please, please understand that. So April says, sounds like if we're a Medicaid PPO office with some fee-for-service patients, then we would not be able to charge. Also, since we can't collect from the patients. Well, if you're a Medicaid and PPO with some fee-for-service patients, you can charge your fee-for-service patients. Medicaid, you're still going to charge it out. You're going to be writing it off. PPO, the vast majority of the time you charge it out, you're going to be writing it off. So, you're still going to have to charge. If you are going to charge, you charge everyone. But you're going to have to do a lot of write-offs because no, you can't collect from the patients. If you are in network with Medicaid or PPO, they're going to dictate to you. They're not saying this is a non-covered service. There's a lot of confusion about what's a non-covered service versus non-payable versus inclusive. Okay, a non-covered service is a crown on a preventative-only plan. It's never, ever, ever going to be covered. A non-payable service is a crown on a regular plan that has a 6-month wait and you want to do a crown 3 months in. That's non-payable. It's not non-covered. Inclusive is, this is considered inclusive. PPE is unfortunately considered inclusive. So in offices like that are in network but have some fee-for-service patients, the vast majority of the payments that you collect as a D1999 are going to be coming from your fee-for-service patients if you're going to charge it. Now remember, you don't have to charge this, but if you do, you have to charge it to every patient. You can't be selective and say, insured patients we're charging, fee-for-service we're not. It's an all or nothing deal. Okay, that is why I truly believe in our poll, the vast majority of offices have determined right now that charging for it is not something they're going to do. Shop around, save money on your PPE. Amir asked, do you think patients with insurance should sign a form for PPE so we can charge them and not bill to insurance? Well, as luck would have it, the next slide is PPE and using the Hipaa form to get paid. The Hipaa form, and Karen, real quick, yes, if you're going to charge it, you absolutely submit it to insurance. If you do anything on an insured patient and you're in network, you submit it to insurance. So even if you know it's a non-covered service. So absolutely, if you are charging every patient, even though you know you're going to have to write it off, you still should be submitting that service along with the others to the insurance company every time. Same process every time. So yes, absolutely, Karen, you are absolutely correct. But the Hipaa form, everybody says, let's get paid. Let's, use this for things that are non-covered. Use this for things that you're not going to get paid on. Use this for rush fees. Use this for upgrades and so on and so forth. It is called a disclosure restriction request. And I want you all to know, we have it on our website, practicemechanic.com/resources. It's the do not bill insurance form. It's on there. We offer it as a resource. I use it. However, there are very specific times when it can and cannot be used. A lot of the consultants out there found out about this form and said, well, let's use it for this and let's use it for that. Let's use it for that. And we're going to increase billing by using that form. Okay. Initially, I will tell you the spirit of the disclosure restriction was specifically intended for mental health. We have latched on to it And insurance companies know that. They're going to be letting their patients know about this. The form they are signing, again, is a disclosure restriction request. It's available on the resources page of our website. Understand that that can be rescinded by the patient at any time. So if you bill out that D1999, the patient signs a disclosure restriction request, you don't bill it to insurance, a week or 2 or 3 or 4 later, the patient gets an EOB with a little insert in the envelope that says, hey, by the way, they're not allowed to charge you for PPE or for this code. So if they have, please let us know. All they have to do is call you or send you a letter or an email saying, I am rescinding my restriction request for date of service, May 5th. You now have to submit that 1999 code to insurance because it's no longer restricted. And they're going to tell you to write it off. And if you've already paid, they're going to make you refund the patient. A couple webinars ago, I showed you guys a letter from Delta specifically stating the patient provided us with a receipt and a copy of a credit card showing that they paid you. You have 10 days to refund them their money, or we will take that money out of your future payment and we will refund it to them. Don't put yourself in that situation. Again, it's usable in certain circumstances. I do not believe this is one of those circumstances. There are some people who say it is. I'm telling you, I do not believe this is one of those circumstances. Okay, you're using a Hipaa restriction request to increase your collections. And that is not in the spirit of the restriction. And it is a direct violation of your contractual agreement with the insurance company. When you are in network, your contractual agreement with the insurance company and your contractual agreement with the patient hold the exact same weight. Okay, not when we're talking about a Hipaa disclosure form, but financial agreement, so on and so forth. They hold the same weight because you are in network with both of them. So, please, please, please make sure you're paying attention to that. Amir asked real quick, for what circumstances can we use the Hipaa form? If the intended spirit of the form was a patient comes in and says they need fluoride trays because they're going through chemo, but they don't want their dental insurance company to know they're going through cancer treatment. So you restrict that submission for the fluoride trays for the fluoride. If a patient has, this is where it gets into the disclosure restriction request. If a patient comes in and they've tested positive for an STD or an STI, and they don't want that information, for testing or for treatment submitted to their insurance company, that would be a time when you use it. It is not to try and circumvent your contractual agreement with the insurance company in order to collect an extra $10 or $15 or $20. That is not the spirit of the bill. And if you look at the example, if you look at the resource page, then that there'll be examples listed on there as well. Yep, Karen said a separated woman who doesn't want her husband to know what's going on. That's absolutely correct. If the husband's getting the EOBs and the separated wife has been somewhere for treatment, the husband's going to see that on the EOB, so she would file a disclosure restriction. It's not for you guys to make an extra 10 or 20 bucks. That's not in the spirit of the order. Somebody asked, will a copy of this be sent to us in an email to re-review what I may have missed? Absolutely. The recording of this webinar is going to be available, and I see Vanessa. There's a couple more questions I'm going to get to, but when I answer this one next, the recording of this webinar will be available in our Facebook group, which is the Dental Billing, Coding, and Insurance Academy. It will also be on our YouTube channel at youtube.com/practicemechanic. So it'll be there in both places. You'll be able to review it. It will be a public video on Facebook. So just check the page and it will be there. Vanessa asked, can we charge a fee for COVID screening? All the extra screening we're doing, or it's inclusive of what we do? It is inclusive of what we do. We are medical professionals. When I go to the emergency room, they don't bill me separately for triage and then bill me for what I had done. They bill me for what I had done. The triage is part of what we do. So again, if you have questions, please don't hesitate to reach out. You can contact us through our website, practicemechanic.com. You can contact me via email, rick@practicemechanic.com, or you can Facebook message me or post a question in the group, Dental Billing, Coding, and Insurance Academy on Facebook, and I answer every question there as well. So, thank you everybody for your time. Have a wonderful day. Have a great weekend, which is coming up soon. And, don't hesitate to reach out with any questions you may have. We are certainly here to answer them. Thank you very much.